We're seeing some coronavirus hotspots with significant drops in new cases in this last week, but other areas with big jumps. Our national investigative team analyzed the last 2 weeks of data for the areas to keep an eye on. Here's Investigate TV's Lee Zurich with our COVID-19 tracker.
The Marion Correctional Institution in Ohio has more positive coronavirus cases concentrated in one location than anywhere else in the country, nearly 2,200. Another prison in Ohio, the Pickaway Correctional Institution, has the second most, 1,641. When the virus enters areas where social isolation is almost impossible, it spreads fast. For example, we found 3,701 cases tied to 20 meat and food processing plants across the country.
These settings, when they do have, one case, it can just explode rapidly and result in large numbers of deaths.
But in hotspot metro areas across the country, like Detroit, Miami, and New Orleans, the number of new cases continues to fall.
The social distancing is working.
I think so. Places that have been successful in implementing it have seen reductions in hospitalizations and deaths.
When you compare this week to last, new cases in the Detroit area have dropped 28%, Miami 37%, New Orleans 49%. But some areas are seeing cases go up. Omaha, 237%, Des Moines, 162%, Amarillo up 148%. But one expert says don't read too much yet into an increase in reported cases.
The reason why you can still see diagnoses going up is because testing was not really very widespread. And so we know that there's a large pool of people with SARS-CoV-2 infection in the population that have not been tested or diagnosed yet. When you scale up testing, you're going to see increases.
And testing is improving. Last week, the United States averaged 180,000 tests a day. This week, nearly 230,000.
When we do get to a place where there's more widespread testing and we can say that we've really, covered large proportions of the populations, then I think the trends in new diagnoses will become more reliable, more useful, and more important to track.
Experts say as we continue to test more and learn more about the disease, we'll be able to track and manage it better.
We're also, I think, learning a bit more about how best to manage COVID disease, even though there's not a treatment per se. Care outcomes can be better as we get more experience and learn about how to manage it more optimally.
Looking at testing across the country since the outbreak began, North Dakota ranks 4th in the country for most testing per capita, while Minnesota ranks 44th. Those numbers from the COVID Tracking Project. Up next on Valley News Live 10 at 10, a drug that's helping some COVID patients gets emergency approval to be used by doctors.